So we've looked at the medicinal actions of cannabis. So these are all of the various performances that cannabis could do within the body. Now let's look at Health Canada's list of conditions that may benefit from cannabis. Now, Health Canada does not go out and say, hey, you can use cannabis to treat these conditions. Basically, Health Canada's stance is like, there's no proof that cannabis works for any medical condition at all, but here are some areas where we may find some use for cannabis. So Health Canada doesn't really come out and endorse it, but it does give some guidelines. Now you won't find this list in the Health Canada document that I've listed as a reference. You have to kind of go through and pick all of these medical conditions out of Health Canada's document. And then I've categorized them as well, just to make it a little bit easier for us to look at. So let's look at the first category, which is neurological disorders. These would include ADD, ADHD, so that's really about focus. Cannabis is, it's one of those interesting ones with cannabis. The right product with the right person can really help somebody really focus in. But it also, the wrong product with the wrong person can actually cause a person not to be able to focus. So it can actually cause that ADD, ADHD. So again, this is the one where we have to be a little bit tricky, and it can be person and product dependent on that one. Alzheimer's disease, ALS, any kind of brain injury. We know that with brain injuries, there's a lot of research into CBD, and some of the football leagues are actually starting to look at how they can use CBD both to prevent and to use as early treatment for athletes who do have head injuries. And it's kind of a really poorly kept secret that the football leagues do have a lot of concussion injuries in them. And it's actually, it may not be detrimental having a concussion. Somebody can get over it pretty quickly, but we're also starting to learn that over decades later after a head injury, that's when we can start to see some really damaging symptoms start to show up. So if we can start treating a brain injury as, at the moment that it occurs, then maybe we can avoid some of those longer term issues with it. So CBD, watch for studies about CBD and brain injuries. It's a really interesting area of focus. Huntington's disease, migraines. One of the ones at the clinic that I work with, one of the biggest issues that we see people coming in with is migraines. Now, I live in a part of Canada, in Calgary, where we get what's called the Chinook winds, and the air pressure can drop, both the air pressure and the air temperature can drop, 30, 40 degrees Celsius in a matter of 12 to 24 hours. And that causes a lot of headaches for people, migraine headaches. Now, of course, there's lots of other reasons that people get migraine headaches, but in the clinic, we find that people who do get on specifically a CBD product as a preventative, that they, within a few weeks, they find that their migraines are both less severe and are occurring less often. And then we can use a THC product to treat the migraine if it does happen to take hold with somebody. So really useful in that area. Multiple sclerosis, Parkinson's, so all of these kind of neurological disorders that we don't have a lot of help with, especially if they involve like the tremors or the neuropathic pain, so tremors of Parkinson's and neuropathic pain from multiple sclerosis, plaque in the brain from Alzheimer's, all of those kinds of things. Watch in the coming decades for some really interesting work coming out. And I suspect, too, this is an area where we'll get some quite targeted pharmaceutical medicines coming out that do have cannabis as a base for them. Post-concussion, we talked about that already. And then spinal cord injury and disease. Again, there's a lot of really interesting research going on in here. Certainly we can use cannabis for bringing down inflammation in that area after an injury or a disease, and also to help with the pain. Regeneration of the spine, we don't know. There's some other interesting studies and research that are happening in that area, but certainly I think cannabis will be a part of healing those types of injuries in the future. So our next category is mental health disorders. And again, this is a category where we have to always remember that cannabis can be a little two-faced in this area, right? So we can definitely help some mild to moderate mental health disorders, but we can also, we do know that there is some danger, some risk associated, especially with high THC use, and especially in young people, where there have been people who have experienced quite severe mental health disorders directly attributable to cannabis. Now, this is rare, but again, we don't know enough about it yet, so why take the risk, right? But mental health disorders could include things like addiction and withdrawal. Cannabis had this stigma as the gateway drug. So back when they were trying to, the propaganda was pretty strong against cannabis, there was a lot of studies that kind of showed that people who went on to use harder drugs, that, where their lives got quite disrupted by the drug use, that, they said that the gateway drug was cannabis use. What often got stripped out of those studies was the gateway drug was not just cannabis use, but alcohol use, cigarette use, or nicotine, and also drugs out of, parents' cabinets, filing medicine cabinets. So a lot of misinformation out there. We're now starting to understand that cannabis could be a really useful agent in helping to somebody get through withdrawals when they're coming off of addiction. And then in areas where people get addicted because they're taking medicine for pain to help manage their pain, and cannabis can help sort of cut back on some of that. So really interesting area of research that's happening here, and I think cannabis is quickly losing that stigma of being the gateway drug and starting to sort of getting a new reputation as being a getaway drug, so getting away from some of these tougher addictions. Anxiety, again, CBD has been really instrumental in helping people with mild to moderate anxiety and even situational anxiety. One of my most rewarding clients in the clinic is especially the young people who come in, and often it's women who come in and their first education session with me, they can't look me in the eye. They have such anxiety, and then they come back for their follow-up. They've been on CBD for 3 months, and they're looking me in the eye and they're just saying that they got their life back, and their parents and their friends are just so happy that they don't have this disorder anymore. So simple solution to something that can, when it's untreated, it can really be affecting lifestyle or their ability to enjoy life as well. Depression, again, we have to be careful with this one. Mild to moderate depression, very severe depression. We don't know enough about cannabis use. If you are educating someone about cannabis use, especially if they're looking to get off their depression, any kind of sort of a little more serious mental health issues, we really want to get physicians involved in that, because again, there's that two-faced sort of the devil and the angel part of cannabis. So definitely mild to moderate depression, and here's where, if it's during the daytime, even just 1 or 2 inhalations of a sativa product, if it's a kind of low to moderate THC or a balanced product THC to CBD, may be helpful in that area, but again, very individualized. Eating disorders, again, this is an area where we don't have enough information. There is, eating disorders, especially in young women. Once that takes hold of a young woman, it's really difficult to break that cycle. Cannabis may be able to be helpful in that, if nothing else, but for treating, helping them to have an appetite, so that they're not feeling guilty about eating. So again, we don't know a lot. We don't know what we don't know about cannabis use and eating disorders, but it may have a place in that area. Same with mood disorders, again, anxiety, anger issues, a little bit of depression, those kinds of things, especially if people are sort of up and down throughout the day. Cannabis can kind of smooth things out a little bit. And whenever I think about mood disorders and drugs, I always like the sort of the old joke that says, you know, 5 guys go into a bar, drink a bunch of beer, and get in a fight with each other. And then, you know, the 5 guys meet on a street corner and smoke a joint, and they form a band, right? So cannabis isn't really known to bring out aggression in people, and it's more reputation around kind of chilling everybody out, calming things down, and having an even playing field. So some interesting areas where we could use cannabis products for just generalized mood disorders. PTSD. PTSD is really interesting, and we know that cannabis is a really important agent in treating PTSD or helping manage the symptoms of PTSD, because all of the licensed producers who are selling medical products will have some sort of a program that will help veterans. Some of them have whole departments that are just dedicated to providing really safe cannabis medicine for our veterans, who are one of the largest groups that are suffering from PTSD. So some really interesting things happening in that area as well. A lot of veterans just intuitively tune to cannabis use, and it's really, you know, it's really, they're getting a lot of hope from now having legalized cannabis, access to legalized cannabis, where they were just getting it off the street before. So a much safer supply for them. And then with that, having better access to treatment and support for that condition. Immunity. So there's some interesting studies that are coming out about cannabis use and immunity. Again, still in early days, how that works. You know, there may be some are kind of saying during COVID that CBD helps keep inflammation down in the lungs and maybe will help your defenses against those kind of pandemic type things. But even just things like arthritis, for both the pain and inflammation of arthritis, cannabis works really well for that. Asthma type disorders, cannabis use, especially CBD, may help to bring down that inflammation in the lungs. And even things like environmental triggers, you know, things like cleaning supplies, scents and stuff that can trigger an asthma attack. I've seen cannabis, especially CBD, use really kind of dampen down those triggers so that somebody isn't as sensitive to that. Again, this is all sort of anecdotal, clinical observations. We don't have a lot of studies in this area yet, but I've definitely seen it help in this area. Things like fibromyalgia, we see a lot of patients with fibromyalgia in the clinic. That's where there's a lot of pain involved with the fibromyalgia, a lot of fatigue that comes from having that chronic pain all the time. And we've already talked about how cannabis can really help with pain and inflammation. So it helps in fibromyalgia. Glaucoma, interestingly enough, glaucoma was the first medical condition that gained approval to use legal cannabis in the United States. There was a fellow there, quite a famous case. He was smoking 2 or 3 joints a day or cannabis cigarettes a day to treat his glaucoma, and it was stopping him from going blind. So he was growing his own product, and then he got caught, thrown in jail, and he sued the government, the federal government, to have access to this plant product to stop him from going blind. And he won that case, and that started to open up the door for cannabis use for other conditions. So glaucoma, interestingly enough, it turns out now that we have a little bit more studies where cannabis can be helpful for the glaucoma condition, but it might not be the best product for it. I mean, it's not going to hurt it at all, but we might have better agents to help with glaucoma now. But there's a little bit of interesting trivia there with glaucoma and cannabis use. Hepatitis C, so again, some of these weird, almost mysterious liver diseases, again, bringing down inflammation is probably helping with that. We don't have a lot of information in this area yet. HIV/AIDS. So a lot of the sort of side effects or conditions that come along with HIV/AIDS is the wasting disease or lack of appetite. Especially a lot of HIV/AIDS patients are on handfuls of antivirals and other medicine that they have to take every day, and that can really dampen down their appetite. So we know that cannabis really helps stimulate the appetite. So this is an area, again, like the veterans, HIV/AIDS patients just intuitively started using cannabis because they really found that it helped them quite a bit. And then, so now they have a legal path where they can actually obtain safe supply of cannabis to help them with those symptoms. Muscular dystrophy. Again, muscular dystrophy has immune areas where it works with the immune system or autoimmune issues that can actually make it worse. But of course, muscular dystrophy is more of a genetic disorder. But because of the immune kind of connection in there with that one, we may be able to use cannabis to help at least manage some of those symptoms to make life a little bit more comfortable for people with that disorder. Moving on, we have gastrointestinal disorders and endocrine disorders. There's a little bit of overlap with these ones. So we've talked probably quite a bit about anorexia, or that lack of appetite. So anorexia, when we refer to it as the actual dictionary definition of it, it is just means lack of appetite. Colitis, Crohn's disease, irritable bowel, nausea, anything to do with gastrointestinal issues, cannabis works really well. It can, 1 or 2 inhalations could really quickly quell down nausea, and can help bring down inflammation for a lot of those irritable bowel issues. Some of that will take time. One case that I worked with in the clinic is a fellow in his early 30s, had a lot of irritable bowel, and it really affected both what he ate and his social life. And so it took a while. It took almost a year of steady cannabis use, mostly CBD every day, and it hasn't cured the disorder, it at least has given him a little bit of room to breathe, gives him a little bit more quality of life there. And then our endocrine disorders, a lot of times those sort of kind of cross over with gastrointestinal disorders. So diabetes, again, depending on what type of diabetes, we're never going to cure diabetes with any kind of cannabis use, but if it can help manage some of the symptoms, manage those blood sugar levels, that's always useful as well. Hypothyroid disease, so anything to do with the thyroid, kidney disease, menstrual pain. A lot of women are using it just to help with that kind of bloating and menstrual pain that they can get during the period, both back pain, those kinds of things. And overactive bladder, this is a really interesting area. We know whenever we start to get commercials on TV, advertising for medicine or devices that can help manage overactive bladder, that has become widespread within the population. It is a big issue. THC use will actually help to calm that down quite a bit, and so there's really great promise there. Some people are finding that when they're using the THC oil to help them sleep at night, they have this kind of bonus side effect, is that they have better bladder control during the daytime. So really interesting areas there, and it was just sort of, I don't think anyone was actually looking for that. Can we use cannabis to help with this issue? It's just one of those things that people were starting to notice, that it was easier to manage an overactive bladder or bladder control in general by using THC. So again, we don't understand how much you need to take or when you need to take it, but an interesting area to note in that area. And then just a few that sort of we know about: seizure disorders and epilepsy. We've talked about Charlotte Figi, the young gal with the seizure disorder down in the States, and how CBD really helped her with that. And so many people are, really finding some relief. Again, not work for everyone, and it's not going to cure the disease, but definitely helping to manage that seizure disorder, epilepsy type issues. Sleep issues, again, another big one where people are coming into the clinic. They want to get off those sleeping pills that just leave them so groggy in the morning. So sleep issues, especially THC, can work with that. Interesting thing, remember those sort of the two faces of cannabis? A lot of people, when they take a CBD product, if they take it a little bit too late in the day or after dinner, they find that they don't sleep. They're awake and alert with it, where other people find that they need the CBD to help them with sleep. And same with THC. And again, the specific products are going to make a difference whether it makes you sleepy or doesn't make you sleepy. But again, we have these two areas. Some people sleep really well on CBD. Some people are cleaning their house at midnight wondering why they're not tired. And other people need THC and it gives them a really good night's sleep. So lots of areas to explore there. Cancer treatment side effects. You'll see lots of memes going around social media that cannabis cured my cancer, cured this person's cancer. That's great. We're seeing that. But we also don't hear about all the people who have turned to cannabis to treat their cancer and it hasn't worked as well. So cannabis is not a cancer cure per se, but we do know it can definitely help with some of the side effects for more conventional cancer treatments, radiation, chemotherapy, those kinds of things. It can really help to keep the appetite going, keep somebody's mood up, help them with sleep if that's an issue. So again, lots of areas that we need to explore here. Chronic pain, we've talked quite a bit about this. Anywhere from just CBD, high CBD to high THC, or combination of both. Some people need one or the other, and some people need a combination of both. It's a little bit, it takes a little bit of experimenting to find the right sort of combination of THC and CBD to help with chronic pain. But again, one of the biggest issues that we see in the clinic. And inflammation kind of goes along with that, chronic pain. Inflammation, as we're starting to find out, what is coming out in research reports, is the scientists are starting to realize that all big diseases start with out of control inflammation within the body. And that could be due to some genetic factors or lifestyle, the food that we're eating, the environment that we're living in, and just personal stress from people around them. That all causes inflammation in the body. And left unchecked, that inflammation could go on in several decades in our later years to cause some of those big disease processes. So if we can keep that inflammation in check in our younger years, perhaps, again, no guarantees, we may be able to avoid some of the bigger disease processes as we get into our elder years. And then palliative care, so end of life, again, helping to treat the pain and discomfort in those last few days, few weeks, few months of a person's life. But also it helps to sort of, without getting too sort of woo-woo, but kind of thinning that veil for the person in transition. But it also helps everyone to sort of keep more calm and be able to enjoy each other's company during those last few days, few weeks, few months of a loved one's life. So lots of interesting things happening in that area. And I think we'll see a lot more sort of specific kind of plans or treatments coming out that will really help with that transition end of things. And then sexual dysfunction, again, from just being an aphrodisiac, helping people to relax, that can be quite helpful. And this is one of the areas where cannabis has been used for centuries to help in that area as well, bringing down inflammation especially in a woman's reproductive area that might be preventing her from becoming pregnant or carrying a pregnancy. So again, no concrete studies on this yet, but lots of promise in this area as well. So we don't have a lot of studies, and I've stressed this over and over again. We're really just beginning to have some really viable clinical studies within the cannabis area, and it's going to be decades before we get some really great results. or at least come to some, definitive conclusions on how cannabis works for specific medical conditions. But in the meantime, we can look to a clinic within Calgary, Alberta, Harvest Medicine, and they have publicly posted some of their reported outcomes. Now, this is self-reported information from patients after they have been using cannabis products for specific conditions over a period of time. So these reported outcomes, while they're not double-blind placebo studies, they do give us really valuable insight into how people are using cannabis on a day-to-day basis just to treat and manage health conditions. So let's take a look at a few of these. The first one is anxiety. So the sample size was 7,674 people. So that's substantial. That's a substantial amount of people to be surveying on this. And they were using cannabis to treat a mild to moderate anxiety. First, on the one side, the one column here, met expectations of treatment. We can see 55%, so over half of the people felt that cannabis helped them or met their expectations of treating their anxiety. About another 33% said, yeah, it helped somewhat. And only 6% said, no, it doesn't help at all. And we did have 6% who didn't really say it was neither here nor there. It didn't really help. It didn't really hurt their condition. But more importantly, what was the impact on the quality of life for people who anxiety was actually affecting their life? And again, we have 35% very positive, 47% somewhat positive, and only 11% with no change. And then only 1% said that it actually didn't help them at all. It made things worse. So that's a pretty great outcome. And that's over the course of 2 years, 2017 to 2019. Next one, we'll look at people who were self-reporting on mild to moderate depression, and they used cannabis use. Again, we have over 50% said yes, cannabis did meet their expectations of treating their depression, and 35% were saying, yeah, somewhat it helped us. And then only about 7% said, nah, it didn't help at all, and maybe it made it worse. And 7% basically said, it didn't really make a difference at all. But again, probably more important is what was the impact on your quality of life? 33% very positive, 47% somewhat positive, 12% said no change, and again, just 1% are saying like, yeah, it actually made it worse. So again, this sample size is close to 7,000 people, so that's maybe not a little better than anecdotal, right? We've got 7,000 people making these reports. Fibromyalgia, again, close to 50% saying yes, it met their expectations, and 38% saying it helped a little bit, somewhat helped. 9% said, yeah, it didn't help at all, and 7% said it didn't really make a difference, neither here nor there. Again, more important, impact on quality of life. 29% find it very positive, and 48% somewhat positive. So that's a big percentage who found that it really helped with their quality of life. And then we have 14% with no change, and 2% found that it actually made their life worse. So again, sample size on this one was about 3,500 people, which is a substantial amount. IBS, or irritable bowel syndrome. So we talked about how cannabis has been used to treat IBS and other gastrointestinal issues. Close to 50%, so 49% said yes, it met their expectations, and 36% said somewhat, only 8% said no, and 7% said it didn't really make a difference at all. Again, more importantly, what was the impact on quality of life? 31% very positive, 47% somewhat positive, 13% no change, and only 2% said that it actually made things worse. So again, sample size there, 4,500 people, so that's pretty big sample size and pretty positive results. Our next one is pain. The sample size on this was pushing 10,000 people. That's pretty incredible, but it also shows you it's one of those issues where people are really looking to cannabis to see if it will help them in their management of pain. And that could be because a lot of the drugs that are traditionally used for cannabis use are proving to be quite addictive or dangerous. So again, we're looking for other areas to help with pain management throughout the day. Over 50%, so 52% said yes, it's helpful, 35% somewhat helpful, 7% said no, and 6% said it didn't make really a difference at all. But again, more importantly, what was the impact on quality of life? So 33% somewhat positive, and 46% somewhat positive, 33% very positive. 13% no change, and only 2% said that it actually made it worse. And sleep, again, our sample size was pushing 5,000 people. That's substantial. And look at that, a whopping 50% said, yes, cannabis use did meet my expectation, helped me get a better night's sleep. And 32% are saying, yeah, it helped a little bit. Yeah, for sure, I feel more rested. 5% said, no, it didn't help at all. And 6% said, yeah, it didn't make a difference. But again, more importantly, what's the impact on quality of life? So 36% very positive, 47% somewhat positive, 10% no change, and only 1% found that they had negative results from that as well. So just kind of summing all this up, overall positive outcomes. So that was a separate question that was on the survey of, and over 12,000 people. So 12,512 people was the sample size that answered this question. Did it meet your expectations or exceed your expectation? 87% said that their cannabis use has met or exceeded their expectations of what they were using it for. And quality of life improvement, over 80% said, yes, cannabis use has improved my quality of life. So again, these aren't double-blind placebo studies, but they're a big enough sample size that we can start to infer some results from that. Some of our double-blind placebo studies don't have this kind of a sample size. Sometimes double-blind placebo studies may only have 30, 40, 50 people in them. So the reported outcomes in this study from clinical use, self-reported use and self-reported outcomes are pretty substantial. So that concludes our health benefits. We've just touched on a whole bunch of areas and disease conditions and health conditions where cannabis may use. We just kind of skimmed the surface of that. We're going to do a much deeper dive in an upcoming module where each of those health conditions, or a lot of those health conditions, are going to be looked at in a lot more depth.